So today I'm working with Jerry Malone, the owner of Orthopaedic Rehab Specialists, and this is our PiezoWave machine. This is pain reduction, pain management through an acoustic sound therapy treatment. For today, we're working on nagging knee pain.
Yes, I am. And the PiezoWave, or what we used to call well wave, is it's sound waves that generate a shock wave into the tissues. So we introduce shock waves into the tissues of various intensities. If there's normal tissue, there's nothing. You feel nothing. If there's abnormal tissue, inflamed tissue, scar tissue, trigger points, you're gonna feel usually some discomfort, a little ache, a little pain. So our communication is such that I'm going to start the machine, I'm going to move it, and when I find a spot, you're going to say, there it is.
Okay.
We treat that spot with 500 pulses, so we shock it for 500 pulses, and then we find another one.
Okay.
And around the knee, we're going to find, 3,000 to 4,000 pulses, maybe 10 to 15 minutes treatment, and we're going to find some spots.
Okay.
We treat those spots, we move to another spot, communicating all the time. There is going to be a little discomfort,
okay,
but it doesn't have to be a lot of discomfort.
Okay.
You have to feel something.
Okay.
Okay, so as we start.
Yeah, there it is, right there.
Okay. It's easy to slide off the spot, so that's why we need communication.
That's it.
And you have to keep me on the spot.
You're right.
Intensity-wise, we can increase the intensity if you just barely feel it. We can decrease the intensity if it's too much.
When you get to part of my knee.
Okay, we're at about 500 pulses, so let's find another spot. It could maybe be very close.
If you went a little lower than that, and just to the right of that, maybe. There you go.
There? That's another thing. After a few times, the patient themselves can direct you.
Yeah.
Okay, just a little bit down, just a little bit up.
Yeah.
Intensity's good.
Yeah.
Still on it.
Yeah, right there for a bit. Yeah. Go to the right, maybe. Right there.
Yeah, that must be a good one.
That's a good one.
These treatments can be done every 4th day because it is a shock to the tissues. You do need 2 or 3 days for that to calm down a little bit, but then you see that after that, on that 3rd or 4th day is when you really go, wow, this is the best my knees felt in months. And that's what we see. Okay, I know we've hit that spot before. Let's find another one.
Right there.
How about there?
That's it. Oh my.
Is that too much?
Nope.
Okay.
But that's the spot.
Now, if that is too much, we can turn it down a couple of notches. That's no problem.
Let's back that down just a little bit.
Better? Still?
That is
That's the money spot.
wow.
Still?
Yeah.
Still. We on it? Too much?
Probably still a little bit too much. Yeah.
You're not supposed to be grimacing that much, Mark. Okay, we're down to 2 intensity.
Okay.
See, it doesn't take much. Our intensity goes from 0
That's accurate.
to 18.
That's accurate right there. That is right. Yeah, that's the spot.
That's the spot. Still on it? It's easy to move off of it. You don't have to move far.
Now, did it become more manageable only because we reduced?
That's part of it. There are times when I can be right on the spot with a good intensity, and then it just kind of dies out.
Okay.
And at that point, you're okay.
If you go to my left, yep, right there, there's a new point.
There's a new point. So we'll start another 500 on that spot. Another thing.
There you go.
Right there?
Yep.
Another thing we find, you know, people say,
back that down.
Back that down. Yeah. No problem.
That's great. But it's okay.
Good.
Yeah.
Another thing, people can say, you know, my problem is here. My problem is here. My problem is here. But we'll find something over here. Sometimes you can feel it there. Mm-hmm. Sometimes you'll do here, feel it here. But they're somehow related.
That's good.
You know, there's something going on over here that can be causing a pain over here. So inside you may have a scar, you may have, you know, an old injury. This will help us kind of locate it.
Gotcha.
There'll be times when I'm still there. I'm working on a spot. They're feeling it in their hip consistently. We may look at the hip. Maybe the hip is causing the knee pain.
Gotcha.
It kind of shows it. It's a very strange and fun little machine.
What a powerful machine, though, for us to right there. Back that down just.
I did.
Wow.
Is that good?
Yeah.
I'm back down to intensity of 3.
Okay.
Which is a grade school child level.
Oh, yeah.
Maybe we should go 2. That's kindergarten. We're down to kindergarten child level.
Oh my gosh.
The person who was very nervous about the initial treatment or had some discomfort, once they feel that relief, they're anxious to get back next week and give it another shot. And then it's more like, okay, move it over a little bit, turn up a little bit. I can take a little more because the results are so good. They want it. They want to come back.
That's outstanding.
Excellent.
So day 3 and day 4 of treatments, or day 3 and day 4 following an initial treatment?
Initial treatment.
Gotcha. Okay.
This is Thursday.
Okay.
Sunday morning, you're going to wake up and say, hey, my knee feels really good today. And then you'll realize, oh, it's from the PiezoWave.
Okay.
And then next Monday, we can do it again.
Okay.
Okay.
All right. Thank you, Jerry.
My pleasure.
All right. Happy to show this machine, the PiezoWave, at Orthopaedic Rehab Specialists.